Good afternoon, everybody. Thanks very much indeed for joining us at our regular weekly press briefing. Apologies for the slightly late start. Three things to briefly take you through at the beginning before opening up to your questions. First is an overview on the latest position with COVID cases in Greater Manchester. Secondly, an update on local data and our discussions with the government on that. And then thirdly, a response to the Chancellor's statement just an hour or so ago. So first to the overview, and I want to bring up a slide which I said last week we would start to present to you on a weekly basis. This is a slide that shows 7-day rate of positive tests per 100,000 population across our 10 boroughs individually, but with an aggregated figure for Greater Manchester. So you can see the figure overall, which is a slight decrease for Greater Manchester over the last 7 days, which is encouraging. And overall, I think the figures, again, moving slowly in the right direction. Perhaps ones to pick out: Oldham, a significant reduction; Bolton, 2, smaller reduction in Rochdale, and obviously continue to keep a focus there. 3 of our boroughs recorded a slight increase over the 7 days, those being Bury, 7.3 as of today, 6.3 this time last week; Salford, 6.6 today from 6.2 last week; and Trafford, 5.5 up from 3.4. What I would say about those increases, they are all quite modest and relate to a very, very small number of cases, and the data overall is going to fluctuate, and we're not concerned too much about that. As I was saying, the overall direction of travel is heading still in the right way, and that is a credit to all of our incredibly dedicated professionals working on the ground across our 10 boroughs. Just to provide a little bit extra for you in terms of supplementing this picture, I've often given the figure for hospital admissions at this briefing, and as you know, that's been coming down week on week over the last 6 to 8 weeks. Last week's figure was 9, so 9 daily admissions this time last week. That has now dropped to 4. So again, movement in the right direction. And that's also reflected in the number of patients in our hospitals. So the number of patients in intensive care has dropped slightly from 24 last week and is at 22 today. But we've seen a much more significant decrease in the number of patients in non-intensive care beds, in more general hospital beds. That has gone down from 342 last week to 187. So real movement in the right direction. And again, that reflects the efforts of staff who have, of course, done a wonderful job caring for people and supporting them through their illness. So figures in pretty much all respects showing the right trend, and an improving picture in our care homes. So that's the summary for where we are. But of course, we want now to present these figures to you every week in this form to keep our eye on the ball and to keep on top of the spread of this virus in our 10 boroughs. And with that in mind, I'll turn to the second point I wanted to update you on, which is the discussions around local data and let's say the slight disagreement perhaps with the government over recent days. The main thing to say here is that I have today written to the Health Secretary with a very detailed paper prepared by our own experts here in Greater Manchester, setting out very clearly what we think we need to keep these figures moving in the direction I've shown to you today. It still remains the case that we do not have access to all of the information that the government receives, and the particular omission is patient-specific data. We are receiving more postcode data, but the particular concern amongst directors of public health is lack of access to patient-specific data. For any other notifiable disease, this would be provided as a matter of course. And directors of public health and their teams are highly experienced when it comes to handling such data, but then using it to maximum benefit for public health. And our call, one of the calls we're making on the Health Secretary, I'm putting to him today in this letter, is to give us access to that data, because we believe the more we have, the better the job we will be able to do. And the call is a simple one: let us have everything that you've got, because the more we've got, the more we will be able to bring cases down. And let me repeat what I said last week: avoid any possibility of a local lockdown in Greater Manchester. That remains my goal. Not able to say that we can prevent it at all costs, of course not. But what I can say is I want to do everything I possibly can to reduce the likelihood of it happening. And the more data we've got, the more we'll be able to do our job. It's not just Pillar 2 test data that we have a concern about. Just to be clear on that, you know, we have full visibility, including patient-specific information on Pillar 1 data. We don't have that on Pillar 2, and that's what we're asking the government for. But it's also the case that we don't receive full information from the National Contact Tracing System. And we believe that if we did, that too would enable us to carry out more speedy investigations on the ground, and then of course manage those local outbreaks. So I've written today to the Health Secretary. Obviously we'll wait to receive his response, but you know, we very much want to form a strong partnership, national government to local government, full sharing of data. We think that is necessary in the phase that we are now in. Moving then on to the Chancellor's statement. And the first thing I want to say is, you know, we welcome many of the measures that have been announced today, particularly the focus on young people with the Kickstart scheme. That was something that Greater Manchester had very much put to the government, the wish to have a scheme that would immediately support young people through this challenging moment, so that we don't see that long-term scarring effect that we can see, which can damage life chances and economic recovery in the long run. We're pleased to see the furlough incentive scheme. We think that will be a support to business and a reassurance to people who are wondering about what happens at the cliff edge in October when the traditional furlough scheme is coming to an end. So we welcome those things. But the first call I would make is a plea on the government to learn the lessons of the response phase, which is too much delivered top down, which doesn't properly work when it hits the ground. I mean, that has been a bit of a theme throughout this. And what we're saying now, as we move into the recovery phase, we are best placed to make sure the scheme for young people, the furlough incentive scheme, have maximum effect. So it's a call on the government to devolve responsibility for the delivery of these schemes to mayors, to combined authorities, local authorities. We know our communities best. We will make sure these schemes work to maximum effect, and I hope the government will be able to work with us on that. The second point to make is more what I would say was an omission in the Chancellor's statement. Many of the measures that he announced almost felt like they would belong to normal economic times, whereas of course we are still in a phase here where we are living alongside COVID, and that presents real challenges for communities where the levels of spread are greatest. And I think more needs to be done to build resilience in our poorest communities. It remains the case that many people on low paid, insecure contracts if they become symptomatic, or if they receive a text message from NHS Test and Trace asking them to self-isolate, will find it very, very hard to do so, because they know they won't be paid if they were to take that time off work. 2 million people in this country have no access to statutory sick pay, and for those who do, £95 a week often does not cover their bills. So I would have liked to have seen the Chancellor make a move to help people comply with NHS test and trace by both giving everybody access to sick pay, by asking all employers to allow people to self-isolate on pay, but also making sure that the level of sick pay is sufficient to give people the ability to take that necessary time off work. So I think more could have been done to build resilience in the communities that are most at risk from the spread of this virus. I think more could have been done to support staff in social care. I believe they should have been given a pay rise now, and also the same guarantees around the ability to self-isolate should they need to on full pay. I think that's the commitment that we should have made. Concerned too that there was no support for company directors. They have been a forgotten part of the support system. Many not wealthy, running small businesses have had no support at all. And that is a concern that hasn't been addressed, and I think it was a mistake not to provide some support for those people. And then I'll finish by just saying something about levelling up, because I would have liked to have seen more focus on measures that would genuinely help us to measure the level up in our communities, and in particular improve the quality of work for people who have been out there keeping the country running in recent times, but who are often on the lowest pay and in the most insecure jobs. Greater Manchester has a good employment charter. We would encourage the government to think about something similar, so that we initiate a drive to improve work for people from the bottom up. And levelling up has to start in that way, in my view. Building the capacity of people and communities, rather than just simply thinking that infrastructure alone will help us to level up. Beyond that, I think the government should look seriously at ideas like universal basic income, to give all people the ability to put their health first, and to have secure housing that doesn't then lead to all of the extra costs that you can see when people are struggling to afford housing costs, the increasing bills for temporary accommodation that we see. I think these are things that need to be done if levelling up is to have real meaning. And at the moment, I think it's lacking that substance behind it. The simple fact is the north of England, many of its communities have been hit hard by this virus, and the reason being because so many people living in those communities can't follow the government's official health advice, because they know they wouldn't be paid and wouldn't be able to feed their families if they did, and also because they are living in overcrowded, often poor quality accommodation. You know, those are the facts, and this is why this virus has hit those places hardest. And I think a government that says it's committed to levelling up should really start to address those things, commit to a real living wage for everybody. For me, that is real levelling up, and I would ask the government to take those thoughts on board as they work towards a more significant spending review later this year. I'm going to leave it there, and I'm going to hand over to Jimmy this afternoon, who's going to take us through your questions. So, Jimmy, over to you.
Thank you, Andy. We can start with two questions on data and the table that you referenced earlier. One is at 2:10 and the other at 2:19. That's from James Much at the Bolton News and Josh Halliday at the Guardian. James says that the Public Health England report said Bolton was in the top 10 of the highest infection rates in the country recently. Is it known what the infection rate is in the town now and what is being done to control it? And Josh in The Guardian asks that the 7-day rate of positive cases is relatively high still in Rochdale. What's the reason for this? And do you have any more detail about what's behind the modest increases in Bury, Trafford and Salford?
Well, thank you. James first. So James, the answer is in the table, Bolton is at a rate of 12.2 cases per 100,000 population. So that's all the cases over the last 7 days, then sort of linked to population, and that gives you 12.2 per 100,000. So I'm pleased that that is a significant reduction from where it was. What is being done? Well, obviously the Director of Public Health in Bolton, Helen Lowy, is working with her team and doing a fantastic job. Obviously working with local businesses. Had a discussion today with the leader of Bolton Council around what more we can do to ensure messages are translated into all languages, spoken locally. All kinds of things are being done to make sure that we keep these figures where they should be, and as I say, in a better place today. Josh, in terms of your question, yes, you are right. It is still relatively high in Rochdale. One thing to say when you ask what's the reason is Rochdale actually have had a more proactive approach to testing than most in throughout this crisis, actually. But recently they've had a military-run testing station, I think, in the town centre. They had a facility at Hopwood Hall. So there's always been a very strong testing operation in Rochdale, but I wouldn't want to say that's the only reason. That clearly there is a need to keep a close eye on the number of cases there. Work with all communities in the borough to get the advice over and to bring the numbers down. But as I was saying at the start, you know, if we had access to patient-specific data, it would help us. It will give us the ability to go straight to the root of the problem, and this is the point, isn't it? Without that data, we're not able to target our efforts as quickly as we might otherwise be able to. Keep using this phrase, but I'll say it again. You know, some people, experts say that if you don't have patient-specific data, it's like asking local detectives to solve crimes without giving them the names of any victims, witnesses, or suspects. And you know, that just stands to reason, doesn't it? The more specific the data, the better the response can be, and we're making that case very clearly and firmly to the Health Secretary. In terms of the modest increases, well, it can be really very localised reasons. As I say, an extra testing regime. I think in Salford's case, we were talking of 1 or 2 extra cases, so a very, very modest change. So, you know, nothing that gives us any particular cause for concern. And I think it's important to say that these figures will fluctuate from 1 week to the next, and people shouldn't get too worried about that. You know, what we will, of course, be worried about is if we see any significant rise week on week.
Thank you, Andy. Still on data, a question at 2:20 from Rob Wincheffel at Channel 4 News. Rob asks that you and many in local authorities have been calling for further data from government for some time. Publicly, the Prime Minister and the Health Secretary have both said they've passed on this data. What is the government telling you as to why you haven't received all that you've asked for?
Well, thanks, Rob. I mean, as I say, we've put a very clear paper, detailed paper to the government today about what we think we need and what we're actually getting. I mean, there's a whole series of things in there. I won't take you through all of them. I mean, one is the timeliness of the data. So we're getting detailed weekly drops of data from Pillar 2, whereas the government gets that information daily. That's one thing. Another thing is the completeness and the quality of that data. So, you know, ethnicity is a crucial consideration when we look at the spread of this virus. But the latest figures I saw was that we get Pillar 2 data that has ethnicity 10 or 20% of times. For the majority, we don't have that data. But the key one is that patient specific, the named patient data. And to answer your question, the government have cited patient confidentiality as the reason why they are not providing that data to local authorities. So that's what I was saying earlier, that is out with the norms when it comes to the procedures for notifiable diseases. The normal procedure is if there is a notifiable disease, that the director of public health in the relevant local authority would be given all of the data, including patient details. So, you know, this system that is running is not consistent with the way we've always handled notifiable diseases. And the simple, you know, call on the government is, you know, the more you give us everything you've got, and the more you do that, the more we will help you bring the number of cases down and keep this virus under control. And I think there is a disagreement here. Let's be blunt about this with the government. They are citing patient confidentiality and privacy as the reason why they're not giving that data to us. My reply to the government, and I've had this direct exchange with ministers, is that does not, in my view, yes, there's a valid concern about privacy, but it does not trump public health and protecting lives in the middle of a pandemic. And actually, the suggestion that that wouldn't be respected is not accepted by public health experts in Greater Manchester. They are very used to handling confidential health data. So I fully support them in that, and in making the call on the government that you know, we should have a system in place here that will be the normal process for tracking and chasing down any notifiable disease.
Thank you, Andy. You may feel that you touched upon some of this with the next question, but Jen Williams at 2:24 from the Manchester Evening News asks if you could explain a bit more about what you are and are not getting from the national track and trace system and what the implications are.
Thanks, thanks, Jen. So I think this is quite a big area of concern, and an area where we're getting not much. So what we do get under the agreement that was reached is the escalated data. So where there's a concern about a particular setting in a locality, then we receive more details from the track and trace system. What we don't get is when there's just you know, more routine cases and the contacts around those cases. That, as I understand it, is not what we're receiving at the moment, and particularly not just the postcode, but the postcodes plural in those scenarios. Because, you know, if somebody is in contact with test and trace, it's not just one postcode, their home postcode, that might be relevant. It might be their work postcode as well. Now, as I understand it, we're not getting that kind of data out of the system. And again, alongside our calls on Pillar 2, we are calling for much, well, again, let us have access to everything. We really don't see why not. You know, the more we're kind of opening out the exchange of data within a confidential framework, the more we are going to be able to manage the threat of any outbreak, and of course diminish the risk of local lockdown. So that also is part of the paper that we've submitted to the Health Secretary today.
Thank you, Andy. So some questions on the Chancellor's announcements earlier. One is Adam Clark at 2:08 from Roch Valley Radio, and then Andy Bounds from the Financial Times at 2:28. Adam asks, you've always campaigned for the young people of Greater Manchester. Do you welcome today's announcement from the Chancellor on the government's plans to give £2,000 to businesses for each new apprentice under 25? And do you think that will encourage businesses across Greater Manchester to hire more apprentices? And Andy Bounds asks, do you believe the Chancellor got the balance right between protecting jobs now and creating them in the future? Is it worth subsidising restaurant chains when many appear to be unsustainable given recent failures? Is it delaying the inevitable?
Well, firstly, Adam, yes, I always believe that we need to prioritise young people for support, not make them the target for cuts. So I'm going to keep consistent with that and welcome what the Chancellor has done today, both in terms of apprenticeships and in terms of the Kickstart scheme. I think both of these things are good schemes, and you know, in the same way that I criticised the government a decade ago for scrapping the Future Jobs Fund, I'm going to praise them today for having gone back to an approach where we intervene to support young people in the labour market. I hope it will encourage businesses to hire more apprentices. We have seen apprenticeship starts go in reverse in recent times, even before the crisis. So you know, we'll be looking very closely to see that we can actually increase the number of apprenticeships. But that's why I say, Adam, it needs to be locally delivered. You know, we know the companies who will be most likely to take on apprentices, treat them properly. You know, we are working very closely with our LEP on all of these things. So the plea today is, you know, great, but let us deliver this for you. We know our colleges, we know our businesses, we're in touch with our young people in so many other ways. We have a young person's task force led by the brilliant Diane Medal. You know, we know what young people want, so deliver this through us. Andy, on your question, I suppose, I mean, it's not for me to put words in the Chancellor's mouth, but I guess he was acting today to address the immediate risk of unemployment for people on furlough, where there may be a concern that might lead to redundancy, but also, as we've been talking about, for young people. So it looks like he today was focusing on those immediate interventions in the labour market, and creating future jobs might be more the territory of the comprehensive spending review later this year. You know, we certainly believe there is a huge opportunity to bring forward a retrofitting programme for Greater Manchester that could result in thousands of new jobs. And you know, we would want to be talking to him and the Treasury about a way of getting that up and running, and a substantial bid going into the spending review. So I don't want to criticise the Chancellor for saying it didn't do enough to create jobs in the future. I think this was about immediate measures to support the labour market. When it comes to measures to subsidise restaurant chains and people eating out, I mean, I guess you know, the support for the industry is welcome, but you know, I'm not so sure that it's going to be, you know, getting more people through the doors that's needed. More, can they cope anyway with the capacity constraints that they've got? So I wouldn't want to think that this is kind of been completely thought through. It feels to me that there are other things that could have been done to support the industry, but I think chancellors always need their headline pleasing initiatives towards the end of their statements, and feels like this one was in that category.
Thank you, Andy. So a question at 2:31 from Adam at Roch Valley Radio. The Institute for Fiscal Studies reported in the last couple of days that the ongoing pandemic poses a significant financial risk to the UK higher education sector. Universities are facing big losses across a range of income sources and investments, and these losses could cause serious financial problems, including in the extreme insolvency. Does this concern you, and are you concerned about universities locally?
Thanks, Adam. Yes, of course it does, because our 4 universities are crucial to the economy, but also life in Greater Manchester. They add so much in so many ways. And it's why we work so closely with them to support them. I won't go into kind of naming individual universities, but I have been in touch with them all individually. And I think the picture with regard to student numbers for the autumn is, you know, I'm going to touch wood at this stage, but it's not looking so bad. So I think we need to be careful, you know, about saying that there is a devastation awaiting the university sector. I think it's going to be challenging, like it is for any sector of the economy and society. But I'm not so sure that at this point we can say it's going to be as disastrous, perhaps, as was first feared. We are working hard with them to ensure that the overseas student numbers hold up, and we're working with Manchester Airport and airlines to ensure that there is support to bring overseas students in, and that's an area of work that's ongoing. But yeah, it's going to be challenging for our universities. We do work closely with them. There has been government investment in research and development announced by the Prime Minister last week. We welcome that. It's going to be a bumpy time for them, but I'm pretty confident they're all resilient organisations, our four universities, and we'll work with them to help them through this.
Thank you, Andy. A question at 2:33 from Teresa at ITV Granada. Greater Manchester Disabled People's Panel are publishing their COVID-19 survey, and the results are shocking. 90% of respondents say the pandemic has had a negative impact on their mental health, and 80% of respondents were not included in the official shielding group, yet 57% of those had support needs. What is the Mayor's reaction to this, and what can he do to help these people in the short and long term?
Well, thanks, Teresa, and you're absolutely right. These results are a real cause for concern. What can I do? Well, I set up the Disabled People's Panel for precisely this reason, to get a focus on the real lived experience of disabled people, and it's been particularly tough during lockdown. Our panel have been working really hard to stay in touch with disabled people across Greater Manchester throughout this. The survey you mentioned was based on responses from 1,000 people, so it's a unique piece of work. There isn't a disabled persons panel like this anywhere else in the country. The issue is, what do we do now with these findings? And I should say, it's not just lockdown that's been hard. I think a lot of disabled people who are in work, perhaps furloughed at the moment, kind of also have real concerns about the return to work and the continuation of their jobs. So what can I do? I facilitated a meeting for the Greater Manchester Disabled People's Panel yesterday with the Minister for Disabled People, Justin Tomlinson. To be fair, we had a really good discussion with him, and the members of the panel were able to speak up for those who completed our survey and communicate the concerns. And I think there's a widespread acceptance that more needs to be done to support people through this time, including by our own councils. And I facilitated a discussion this morning with the 10 council leaders of Greater Manchester, digesting the findings of this survey, looking at what more can be done to support people. Of course, shielding policy is not the responsibility of Greater Manchester. That's been decided nationally. What we've got to try and do is provide more informal support for people who've perhaps fallen outside of that category through our community hubs. But you're absolutely right. I think this tells us something new. I don't think we've had focus on what it's been like for people with disabilities throughout lockdown. I think their voices have not been properly heard, and I'm proud that we have brought their voices to the fore through this survey. The issue is what now? What is done now? So we've communicated the results to the government. We've digested them ourselves in Greater Manchester. We're going to bring back a proper response as Greater Manchester Combined Authority with the 10 districts to our panel to say what more we can do. But of course, some of what we need is help from the government too. So we're going to be keen to press the Minister for a proper response too.
Thank you, Andy. And then a final question, unless there are any submissions at the last minute. This is from Aaron at Roch Valley Radio at 2:35. And Aaron asks, with the Rugby League Championship and Division 1 not set to return until the autumn or winter at the earliest, do you believe clubs will be able to play with crowds before Christmas, as spectators will be vital for the economic survival of those clubs?
I don't think there's any guarantee about that. Obviously, it's different for a stadium compared to, let's say, a theatre where it's enclosed. Obviously, the kind of open air nature of a sports stadium possibly means there may be a return to crowds at games earlier than perhaps for the performing arts, but there's no guarantee about that, and I certainly wouldn't want to put that timetable on it. So I think the issue here is what support can be provided for for sports throughout this period until we can see a return to the crowds coming back. Rugby league, I think, has had some support from the government, and that's welcome, but I'm not sure it's equal to the scale of the challenge that our clubs will face. So I think, and this would be true of the arts as well, by the way, that we need to make a case for continued access to furlough until full live performances can resume, because otherwise I think many are going to face real difficulties as we get later into this year. And can I just say something very quickly about Wigan Athletic? A very, very worrying state of affairs that a club could just be plunged into this level of crisis pretty much from nowhere. Major questions, I think, here for the games regulatory authorities as to how they vet potential owners of football clubs. But I think the most significant issue coming out of this is for football now to ensure that the billions in the Premier League come right down the system and support clubs at every level of English football, because without that, I think we're going to see many proud names end up in the place where Wigan are. Now, we're going to do everything we can to support Wigan. I'm working closely with Lisa Nandy, the MP for Wigan, and with supporters groups in the way that we tried to support Bury and Bolton. We will give them all the support that we can. But, you know, professional sport matters to all of the communities in Greater Manchester. These clubs are loved by our communities. We see it as crucial that we support them. I think rugby league might need more help from the government, but I think football, first of all, needs to look to itself and look to the Premier League to provide more support. And that's certainly a call that I will be pushing strongly over the coming weeks. So thank you, Jimmy. If that's everybody, that's quicker this week. So thanks everybody for your questions. I will just summarise by saying, you know, we're cautiously encouraged by the figures that we've got for Greater Manchester this week. But the summary that you've heard today is the more data that we've got, the more chance we have of keeping these cases in the position that you see today. Obviously, as we see the further easing from lockdown, the challenge becomes greater. We want to work in partnership with the government on this. We don't want a disagreement or a row. We want a resolution, and I hope, and I would ask the Health Secretary to provide a positive response to the letter that we've sent today.